Anatomy review of skeletal system and joints. So the skeletal system consists of 206 bones, most of which are paired, and we divide the skeletal system into two divisions: the axial skeleton, which is about 80 of those bones, and the appendicular skeleton, which is the rest. The functions of the skeletal system include support, protection, movement, mineral and growth factor storage, blood cell formation, and triglyceride or fat storage. Let's start with skeletal cartilage. Very similar tissue to bone. Both are connective tissues. The difference is that skeletal cartilage is avascular, meaning that it contains no blood vessels or nerves, whereas skeletal tissue is highly vascular and gets its nutrients from perichondrial, connective tissue, and blood vessels. There are three types: hyaline cartilage, which is mostly support, flexibility, and resilience, and is the most abundant type. Find that in articular cartilage, costal cartilage, respiratory cartilage, and nasal cartilage. And then there is elastic cartilage, which, just like the name, is very flexible. It withstands much repeated bending. We find that in the ear. An epiglottis has a lot of elastic fibers. And then there is fibrocartilage, very highly compressible, has a great tensile strength, so very strong, not as flexible as the others, lots of collagen fibers. We find that in the knee, in the menisci, and in the intervertebral discs. Here's a diagram showing the two divisions of the skeleton, so you can see that the skull, thoracic cage, and vertebral column are all going to make up the axial skeleton. And then the clavicle, scapula, and then arm bones, hand bones, and then the pelvis, as well as all of the leg bones and foot bones are part of the appendicular skeleton. So they're color-coded there to help you see. Where a lot of people mess up is thinking that the clavicle and scapula, because they do sit over the rib cage, sometimes it gets confused that they're part of the axial skeleton. They are actually part of the shoulder girdle, so they are part of the axial skeleton. Bone structure. So bone has a lot of markings. When you look at bone, it's not smooth. It has a lot of projections, depressions, openings. These are all places where muscles, ligaments, and tendons might attach. Also maybe joint surfaces or even passageways for blood vessels and nerves. So I have many of the common projections listed there. Both those that serve as site for muscle and ligament attachment and those that help form joints, as well as some common depressions and openings. I'll give you an example from each column. Tuberosity, for example, the tibial tuberosity is a projection, very large projection on the tibia. It is where the quadricep muscles attach. So you can see quadriceps, being a very strong muscle group, will require an attachment that has a lot of raised bone. So that's a very large projection. Then we have, for example, the head of the humerus, or the head of the femur. The head of the humerus is basically the ball that fits into the socket of the clavicle to form the shoulder joint, and on the femur, the head of the femur is the ball on the femur that fits into the socket of the hip joint. Depressions and openings a lot of times are going to serve as passageways. One very large fossa in the body, one very large foramen in the body, the foramen magnum at the base of the skull, is where the spinal cord leaves the skull, and also we see some vessels and nerves pass through there as well. Bone structure. So really bone can be composed or can be classified into either spongy bone or compact bone. So our spongy bone is trabeculated bone. It looks like the picture shows you, kind of a honeycomb appearance. This is where we find red bone marrow, and blood cells are produced in red bone marrow. We find spongy bone usually sandwiched in between layers of compact bone. We find it in the ends of long bones and flat bones, and that sort of thing. Compact bone, again, the external layer of bone. It's also dense. It consists of very highly arranged, organized conversion systems, or osteons, which we're going to talk about in just a bit. Spongy bone does not have that same alignment of the osteons. It actually looks a little more chaotic, though it's not. It just appears to be more chaotic. So let's take a look at compact bone in the convergence system. So the osteon is the structural unit of compact bone. It is a group of hollow tubes of bone matrix, and when you take a cross-section of bone, you can see the concentric rings. These are really concentric rings of collagen fibers that make up our compact bone and give bone its tensile strength. So collagen fibers are known as the twistor resistors. They help resist torsional stress. And you can see from the picture the concentric rings line up, look a lot like the tree rings, rings of a tree. So taking a closer look at an osteon, you can see again, if we take out one of these units, we can see there are actually layers of lamellae. These concentric rings are lined with, they're called lamellae and lined with collagen fibers. If you take a closer look, you can also see around the canals, you can see little holes. We call those lacunae. That's where the osteocytes are found. There are also canaliculi, which are connect these lacunae together and to the central canal, which runs down the middle of each osteon. Volkmann's canal are perpendicular to the central canals, and they, with the central canal, basically provide passageways and routes for nerves and blood vessels because, again, bone is highly vascular. So you can take a look at that diagram and see all of those structures labeled. Bone classifications. There are a few classifications of bones. We have long bones, which are, as the name implies, longer than they are wide. Short bones are about as long as they are wide. Flat bones are just that, flat. And then irregular don't really fit a category, so we give them their own category of irregular, and they are all different kinds of shapes. And on the right-hand side, you can see an example of each of these classifications of bones. So let's take a look at a long bone. We can take a long bone, and it has an anatomy of its own. So the long bone will be composed of a diaphysis and an epiphysis. So the diaphysis is the shaft. That's the long part of the bone. It is compact bone that surrounds a hollow medullary cavity. This medullary cavity contains yellow bone marrow, which is mostly fat or triglycerides. And in the event of a hemorrhage, can become red bone marrow, but for the most part, is just a fat storage for the body. Epiphyses are the ends. There's one on each end. They are in mostly spongy bone on the inside. You can see the epiphyseal line in a young bone, which, or epiphyseal line in an adult bone, was the epiphyseal plate in a child, in a pre-puberty child, and this is called the growth plate. So the epiphyseal plate is the growth plate. It closes and becomes the epiphyseal line. You can see separating the diaphysis from the epiphysis. And then on the end of each epiphysis is cartilage to cushion the joint, to cushion the joint surfaces, and that is hyaline cartilage. Bony membrane. So bone is living tissue, therefore it has membranes. It has an outer membrane that is periosteum. It's very dense covering, and then endosteum will cover or line, rather, that medullary cavity. And now we move into joints and articulations. So joints are basically places where two bones join together, and the articulation or joint provides our skeleton mobility. There are classifications, structural and functional, and each of those is based upon a couple of things. So functional will be based upon what kind of movement we see in that joint, and structural based upon the kind of binding material. In this diagram you see some examples. So if we were to classify joints functionally, basically how much they move, we would see that synarthroses are immovable, like the sutures. Amphiarthroses are slightly movable, like your joints between your vertebrae, the body of your vertebrae. And then diarthroses are freely movable, like the elbow, shoulder, hip, or knee. And then structurally, what those joints are made of, these sutures are made of, joined together by fibrous material or fibrous tissue. The cartilaginous joints are most of our amphiarthroses, and they have hyaline cartilage. And then synovial joints have a synovial capsule. So there is a fluid in those joints. They move a lot, therefore it makes sense they would need fluid for lubrication. And now let's take a look at synovial joints. Again, diarthroses, freely movable. They include all limb joints, and most joints in the body are in this classification, and they have some distinguishing features. They have an articular cartilage, which is hyaline cartilage. There is a joint cavity where we find the synovial fluid, very small space between the joints. The joint capsule really surrounds that cavity and creates that cavity. Synovial fluid is inside the cavity, and again, that is a lubricating fluid. There are always reinforcing membranes. We find a lot of nerve and blood supply in our joints, and you can see in the diagram all of those structures listed. Types of synovial joints, we have plane joints, hinge joints, pivot, condyloid, saddle, and ball and socket. You can see examples of each in the diagram on the right. Synovial joints, again being our most movable, are the ones that produce these movements that maybe you are familiar with. So like flexion and extension, abduction and adduction, lateral and medial rotation, pronation, supination, inversion and eversion, protraction and retraction, elevation, depression, and opposition, circumduction. Those are all examples of movements that are produced by synovial joints. And then we go through each joint. The knee joint is the largest, most complex joint in the body, and some key features is that the medial and lateral meniscus in the knee really prevent side-to-side translation, and the anterior and posterior cruciate ligaments prevent anterior-posterior translation. So the knee joint doesn't really have any physical limitations. It is just, one bone on another, and it is the soft tissues, muscles, and ligaments that help stabilize this joint. Very complex, easily injured, but lots of weight-bearing requirements of the knee joint. Again, very complex. You can see joint capsules thin and absent anteriorly, and really relies upon muscles and tendons to keep it stable. And more pictures of the inside. You can see the articular cartilage on the femur, as well as the anterior posterior cruciate ligaments, and then the medial and lateral menisci. And then we also have some exterior collateral ligaments and medial and lateral collateral ligaments, in addition to the interior ligaments. Moving on to shoulder joint, it's a ball and socket joint. Head of the humerus fits into the glenoid cavity of the scapula. We sacrifice some stability for freedom. It's our most freely movable joint in the body, but also our weakest and easiest to dislocate. Well, not the easiest to dislocate, but very easy to dislocate, commonly in the anterior-inferior direction. So the stabilization here is mainly due to the rotator cuff muscles. And you can see a lot of bursa and tendinous structures there that help to hold and reduce friction in that shoulder joint. And again, more pictures of bursa and the tendon sheaths that help cushion all of the many tendons that surround that joint. Then we're left with the hip joint, which is the ball and socket joint. The head of the femur articulates with the acetabulum of the pelvic bone. It's a very deep socket. This is the opposite of the shoulder. We have now less flexibility and mobility, but more stability. Very strong and stable joint, reinforced by many reinforcing ligaments, as you see there. And another picture here that the head of that femur really fits deep into the socket. So very stable joint. And a few more images of that hip. And then the last part of this slide goes into bone growth and ossification. And I have about 30 seconds left of this recording, so I will allow you to explore bone fractures and stages of healing on your own.